More than 1,000 Hong Kong residents who live in buildings with COVID-19 variant cases are now eligible for release from quarantine. That's part of a major easing of coronavirus confinement rules in the city. Anyone who is fully vaccinated no longer needs to spend 21 days in quarantine. Those who had close contact infected with a non-mutant variant can self-quarantine for 7 days and self-monitor for another 7. But those exposed to a virus variant would have to do 14 days in quarantine centres and 7 days of self-monitoring. They will also have to be tested 4 times over the course of their isolation.
For those who are currently under quarantine, they need to have a negative test on basis of PCR for COVID-19 before they can be released back into the community. So that is applied to all situations. If currently there is an estate, for example, or housing block, which just undergone the test RTD, restriction testing declaration, and all the results are come back negative, then this updated quarantine arrangement can apply.
The new rule comes as the government is trying to encourage people to get immunised. Hong Kong will also shorten the city's mandatory quarantine period for fully vaccinated inbound travellers from next week. The length of time will depend on where they are arriving from. And people entering from Australia, New Zealand and Singapore will have to quarantine in a hotel for 7 days, down from 14. Those from medium and high-risk areas will have to quarantine for 14 days rather than 21.